Okay, case 3. A 58-year-old man comes to the physician complaining of occasional chest pain that occurs with strenuous activity. He is obese and has a history of hypertension and diabetes mellitus. During the physical examination, he admits to eating most of his meals at fast food restaurants. He also reports he has little time for exercise. What is the most likely diagnosis? Stable angina, characterized by chest pain with exertion, is often secondary to atherosclerosis. Stable angina is chest discomfort that occurs only during activity and resolves within several minutes of ceasing the activity. Patients with stable angina have minimal or no chest pain at rest. By contrast, unstable angina is defined as chest pain that changes or worsens. Unstable angina occurs at rest or increases in frequency, severity, or duration. So, what risk factors increase a person's likelihood of developing this condition? Hypertension, diabetes mellitus, advanced age, gender, and hyperlipidemia are major risk factors for atherosclerosis. Family history and smoking are also risk factors. Obesity and lack of exercise have not been definitively linked to increased risk of atherosclerosis, believe it or not. What is the pathophysiology of this condition? Endothelial injury resulting from various factors, including hyperlipidemia, smoking, and hypertension, can lead to monocytic and lipid infiltrates into the subendothelium, which are called fatty streaks, release of growth factors leading to smooth muscle cell proliferation, into the intima, which is called proliferative plaque, and subsequent development of foam cells, and complex atheromas with calcification and ischemia of the intima. So which arteries are most commonly affected in this condition? Atherosclerosis preferentially affects the branching points of arteries or areas of turbulent blood flow, including the proximal coronary arteries, popliteal arteries, renal arteries, carotid arteries, and arteries of the circle of Willis. What complications are commonly associated with this condition? In addition to angina, other complications of atherosclerotic injury include aneurysms, myocardial infarction, stroke, ischemia, and ischemic bowel disease. And finally, what are the major forms of angina? First, stable angina. Chest pain with exertion responds to nitroglycerin. Unstable angina. Chest pain at rest, secondary to thrombus in a branch, may not completely respond to nitroglycerin. Antithrombic agents and heparin may also be required. And lastly, Prinzmetal angina. Chest pain at rest, secondary to coronary artery spasm, and treatment includes calcium channel blockers. And to finish off this, we will end with the last part of that song.